You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about prenatal testing in the second half of your pregnancy. This is a different conversation than the tests that are offered earlier. Many of these tests give you results in real time, and many can affect your birth plan. So as a result, decisions at this stage can feel a lot heavier. One, because you're closer to birth, and because the consequences of these results land more immediately. So in this episode, this is your comprehensive evidence-based guide to prenatal testing in the second half of pregnancy. We'll walk through gestational diabetes screening, Group B strep testing, fetal well-being tests, and growth ultrasounds, and what's unique about your partner's involvement when results are arriving in real time. You can see the full article and all of the resources for this episode at pregnancypodcast.com/prenatal testing third trimester. There's a lot to navigate in pregnancy, and prenatal testing is one of the more confusing pieces. Pregnancy Podcast Premium is built to take the confusion out of every decision and question that you have. When you are a premium member, you get the entire library of episodes, all ad-free in your favorite podcast app. So you have access to evidence-based answers and information for every question from your first trimester through life with a new baby. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. VTech is the #1 baby monitor brand in North America and trusted by millions of families. The VTech RM7968 monitor has 4K video and a 7-inch parent unit with 360-degree pan, tilt, and zoom to follow every move. Save $20 at Target from May 3rd to May 9th only, and you can check out all of my favorite VTech monitors at pregnancypodcast.com/VTech. Zoller goes above and beyond in formulating their Prenatal Plus DHA. They use high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. Zoller always has an exclusive promo code running for Pregnancy Podcast listeners, and you can find the current code at pregnancypodcast.com/vitamin. The Pregnancy Survival Kit from 8 Sheep Organics includes 4 pregnancy-safe products designed to help with the most common pregnancy symptoms, like stretch marks, insomnia, restless legs, and leg cramps. Right now, you can get $30 off the kit with free shipping, plus an additional 10% off when you go to pregnancypodcast.com/8sheep. And try it risk-free for 100 days. If you're not 100% happy with your purchase, they will send you a refund, no questions asked. This episode is a companion to the episode on testing in the first half of your pregnancy. The first episode covered all of the testing offered through your anatomy ultrasound. That includes blood work, carrier screening, genetic screening, and the anatomy scan ultrasound, of course, as well as diagnostic testing. If you have not listened to that episode yet, I highly recommend that you check it out. It's pregnancypodcast.com/prenatal testing. Testing in the second half of pregnancy is different in a few important ways. First, you tend to get results for these in real time while you are still at your appointment. Secondly, these results can directly affect your birth plan. For example, a result could determine that you need to receive antibiotics during your labor, or whether your baby's well-being will warrant additional monitoring. A glucose test could result in changes to your diet or potentially medications. As a result, decisions in this stage feel heavier. you're getting closer to meeting your baby, and the consequences of these results land more immediately. I want to give you a very brief refresher on a couple foundational principles that you need to keep in mind regarding prenatal tests. The first is that they fall into two main categories. Screening tests tell you the likelihood that a condition is present. Diagnostic tests give you a definitive answer. If you receive unfavorable results from a screening test, do not jump to the worst case scenario. A screening test can only tell you that you may want to consider additional testing. It does not deliver a diagnosis. Another important thing to keep in mind is that every prenatal test is optional and should include informed consent. That means that your provider explains what the test is, why it's being offered, what the results can and cannot tell you, and whether there are any risks or alternatives. You always have the right to decline any test or ask about your other options. You only have options if you know what those options are. First, let's cover gestational diabetes testing. During pregnancy, your body naturally becomes more resistant to insulin, and as a result, more glucose stays in your blood. This is good because it delivers more glucose to your baby, which they need for all of that growth. For most pregnant women, the pancreas compensates for this by producing additional insulin. But for some, the pancreas can't keep up, and blood glucose climbs. This creates a condition called gestational diabetes. This is relatively common, and it's manageable when it's identified. Nearly all pregnant women in the United States get this screening test, even if you do not have risk factors. When I say this is common, gestational diabetes affects roughly 8% of U.S. pregnancies, and that rate has been steadily climbing. An analysis from 2025 of more than 12 million births found that gestational diabetes increased 36% from 2016 to 2024. So this is common, and if it continues, the rates will continue to rise. Testing typically happens in two stages. The first stage is the glucose challenge screening. This happens between 24 and 28 weeks. If you have risk factors for gestational diabetes, like a history of gestational diabetes in a previous pregnancy, your care provider may test you earlier. For the actual screening test, you don't need to fast for it. You're going to show up to your appointment, you drink a sweet glucose solution, and then you'll have your blood drawn 1 hour later. A blood sugar level above a threshold, usually 130 to 140 milligrams per deciliter, indicates that further testing is warranted. You should know that most women that have a positive screening test for this initial test end up not diagnosed with gestational diabetes on follow-up testing. You may have additional options for this test if you know what those options are. Some providers offer alternatives to the glucose drink, like eating a measured serving of jelly beans. Some providers will also consider home glucose monitoring for a period of time, usually a week or two, as an alternative to the standard test. The glucose drink is very sweet, and it contains dyes and other ingredients that some expecting moms wish to avoid. Not every doctor or midwife will give you alternative options, but the key takeaway here is that you may not know all of your options unless you ask. If your screening test is positive, the next step is a diagnostic test. This is the 3-hour glucose tolerance test. For this one, you do need to fast, typically for at least 8 hours before. For that reason, this appointment tends to get scheduled in the morning. When you arrive, your provider will draw a baseline blood sample to measure your fasting blood sugar. Then you drink a larger glucose solution, and then you will have your blood drawn again at 1, 2, and 3 hours after the drink. If 2 or more of your readings come back elevated, then it's likely your care provider will diagnose you with gestational diabetes. If you are diagnosed with gestational diabetes, the first line of management typically involves dietary changes and blood glucose monitoring. It's possible that you would get referred to a dietitian or a diabetes educator to help you learn how to balance your meals. The general approach focuses on consistent carbohydrate intake spread across smaller meals and snacks. Regular physical activity also helps your body use insulin more effectively. Simply taking a walk after meals is one of the easiest and most effective interventions. A diagnosis of gestational diabetes also means that you will begin checking your blood glucose at home. This typically means once in the morning when you wake up for your fasting glucose, then following each meal. Home blood sugar testing uses a small lancet device that pricks your fingertip with a tiny needle, and then you place a drop of blood on a test strip that goes into a monitor, and that gives you the result. The whole process takes a few seconds. It's slightly annoying to have to prick your finger several times a day. It might be mildly painful at first, but most women get used to it very quickly and then find that it's not a big deal. If you're testing your blood sugar at home, your provider is going to give you target ranges. Most expecting moms with gestational diabetes can manage their blood sugar through diet and exercise alone. However, if your numbers are staying above those targets, your provider may recommend medication. The most common options are insulin, which has been the standard treatment for many decades, and metformin, which is an oral medication that's become more widely used in recent years. Gestational diabetes also changes how your pregnancy is monitored. You may have additional growth ultrasounds to track your baby's size. Your care provider may also recommend more frequent fetal well-being tests as you get closer to your due date, and we will talk about both of those later in this episode. For a more detailed walkthrough of testing and treatment of gestational diabetes, there is a full episode that does a deep dive on that topic that I will link to in the article for this episode. Next, we have Group B strep testing. Group B strep, or GBS for short, is a common bacterium. It lives harmlessly in the gastrointestinal tract, vagina, and rectum of many healthy adults. According to the American College of Obstetricians and Gynecologists, the prevalence in pregnant women is between 10 and 30%. It is reported to be higher in Black women and may vary by geographic location. The concern in pregnancy is that GBS can pass to your baby during birth. The vast majority of babies that are exposed to GBS during birth don't become sick, but a small number will develop infections that can be quite serious. The screening and treatment system in the United States has dramatically reduced infant GBS infections. According to ACOG, implementation of national guidelines for antibiotic prophylaxis means that it's given ahead of time, has reduced early onset GBS infections by more than 80%. They state that infections declined from 1.8 per 1,000 live births in the 90s to 0.23 per 1,000 live births in 2015. Because GBS colonization can come and go, testing happens closer to birth. ACOG recommends universal screening between 36 and 37 weeks, 6 days. This test is a simple swab of your vagina and rectum that is sent to a lab, and then results are typically available within 24 to 48 hours. If you test positive, your provider will offer intravenous antibiotics during labor to reduce the chance of transmission to your baby. The effectiveness of antibiotics for preventing early onset GBS depends significantly on timing. Research has shown that 4 or more hours of penicillin or ampicillin before delivery is highly effective. Effectiveness is around 91% in term babies and 86% in preterm babies. There is a lot more to this. And if you test positive for GBS, I highly recommend that you listen to a separate episode that is a deep dive with all of the nuance on that topic. Generally, GBS does not transmit to a baby during a cesarean. And the reason for that is that your baby's not passing through the birth canal, and that's where GBS lives. However, GBS testing is still recommended even if you have a planned cesarean. The reason for that is that it's possible that your labor starts or your water breaks before that scheduled surgery, and that can increase the risk of transmission. There is some interesting research on whether probiotics can reduce GBS colonization. A 2022 systematic review and meta-analysis found that probiotic use decreased the probability of a positive GBS result by 44%. Other studies have shown more mixed results. The evidence on this is encouraging, but not conclusive. And for a full deep dive on probiotics, antibiotic management, and the treatment options if you test positive for GBS, I will include a link to a deep dive episode on that topic. Next, we're going to talk about tests that are specifically looking at your baby's well-being. Before we do that, I would like to thank the sponsors that have supported today's episode. A lot of companies have exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. A baby monitor is one thing that you will rely on multiple times a day, probably for years. And that makes it worth investing in a model that delivers clear video, solid night vision, and room coverage that actually reaches every corner. The VTech RM7968 video baby monitor is built for exactly that. It comes with 2 cameras, so you can watch 2 rooms on a split screen or get 2 angles in the same room. The cameras deliver 4K ultra high definition video to your phone, tablet, or the 7-inch color LCD parent unit with 360-degree pan, tilt, and zoom. There's super night vision, which helps keep a clear view in low light, a touch adaptive multicolor night light, which automatically adjusts to the room, and a temperature sensor. You also get 2-way talk, soothing sounds, and lullabies, and free remote access through your phone or tablet with no subscription fees. VTech is the #1 baby monitor brand in North America and trusted by millions of families. This week, you can save 20% on the VTech RM7968 at Target from May 3rd to May 9th. Check out my favorite monitors from VTech at pregnancypodcast.com/VTech. If you've listened to this podcast for a while, you know that I have done a pile of research on prenatal vitamins and a lot of the components that go into them. My #1 recommendation for a prenatal vitamin is the Zoller Prenatal Plus DHA. And that's because Zoller goes above and beyond in formulating their vitamin with high quality ingredients, like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. Zoller is not looking for the cheapest option. They're genuinely looking for the best quality ingredients. Rather than using folic acid, which is what most prenatal vitamins include, Zoller uses a body-ready form that doesn't require complex conversion. And why does that matter? Well, about half of people have trouble metabolizing folic acid properly. And this is just one reason on a very long list as to why this is my top recommendation for a prenatal vitamin. Zoller is very generous and always has an exclusive promo code running just for pregnancy podcast listeners. You can always find the current promo code at pregnancypodcast.com/vitamin. Let's get back to today's episode. So far, we've talked about tests that are primarily looking for things in you. Several tests in the second half of pregnancy specifically focus on assessing your baby's well-being. Providers typically offer these if there's a specific concern that arises. For example, if there's decreased fetal movement, if you have a high-risk pregnancy, or if your pregnancy goes past your due date. Also, if there's concerns about placental function or fetal growth, that can also lead to fetal well-being testing. Or if you have conditions like gestational diabetes, high blood pressure, and preeclampsia, that can also involve fetal well-being surveillance as part of your routine prenatal care. First, the non-stress test. This is also referred to as an NST. It monitors your baby's heart rate and your uterine activity over about 20 to 30 minutes. This is called non-stress because no stress is placed on your baby. It's just an observation. Your provider will place 2 belts on your abdomen. One is picking up the fetal heart rate, and then the other is tracking any contractions. The test looks for accelerations. These are small temporary increases in your baby's heart rate, usually in response to movement. A reactive non-stress test means that your baby's heart rate accelerated in response to movement in the expected pattern. This is reassuring. This is really what you want. A non-reactive non-stress test means that the expected accelerations did not occur. However, a non-reactive result doesn't necessarily mean that something is wrong. For example, your baby may have simply just been sleeping during the test. If your test is non-reactive, then your care provider will typically follow up with an additional evaluation. Another test is a modified biophysical profile. This combines a non-stress test with a measurement of amniotic fluid volume. Your provider can measure amniotic fluid volume with an ultrasound. They're either going to look for a measurement from the single deepest pocket, or they're going to use an amniotic fluid index calculation. Both of these are very quick measurements with an ultrasound. The whole modified biophysical profile typically takes about 20 to 25 minutes. Then you have a full biophysical profile. This includes the non-stress test plus an extended ultrasound evaluation, and it's scoring 5 aspects of your baby's well-being. These are fetal breathing movements, body movements, muscle tone, heart rate reactivity, that's the non-stress test component, and the volume of amniotic fluid around your baby. Each of these categories receives a score of 0 to 2 points for a possible total of 10. Higher scores are reassuring, lower scores can prompt further evaluation, and in some cases, consideration of an early delivery. Full biophysical profiles are sometimes done at regular intervals. For example, if you have a very high-risk pregnancy, you may have these done weekly. Of these 2 options, the modified biophysical profile is most commonly used as the initial assessment when fetal well-being testing is needed. It's faster than a full profile because it doesn't require an extended ultrasound observation period. The full biophysical profile scores additional aspects of fetal well-being. That's why it needs more time to do that evaluation. Research supports the use of a modified biophysical profile as an effective initial test in many situations, and as a result, providers tend to reserve that full biophysical profile for situations in which a modified test is non-reactive or there's a more specific concern. If you're coming out of an appointment with a non-reactive, non-stress test or a low biophysical profile score, that can be a very stressful thing to deal with. However, knowing what typically comes next can help. The first thing that you need to keep in mind is that a single concerning result does not automatically mean something's wrong. And in many cases, an additional evaluation will give a much clearer picture before any decisions need to be made. After a non-reactive, non-stress test, the next step is often a modified or a full biophysical profile. Providers can sometimes use vibroacoustic stimulation. This is a brief sound stimulus to wake up your baby and reevaluate. If a biophysical profile score is low, your provider may extend the observation period, they may repeat the test, or order additional studies using something like a Doppler ultrasound to assess blood flow. If multiple tests continue to raise concerns, your provider will likely discuss delivery timing with you. And that decision depends on a lot of factors. The gestational age of your baby, the specific findings of any tests, your overall pregnancy history, your baby's growth, a lot of things factor in. What looks like a worrying result in one situation may lead to repeat monitoring, or depending on how things progress, it could lead to a conversation about an induction or a cesarean. This is why you're working with a doctor or midwife. They can walk you through the test results, all of your options, and what makes sense for your specific situation. Beyond fetal well-being tests, you may also have additional ultrasounds in the second half of your pregnancy that are growth scans. Providers use these to estimate your baby's size and check the amount of amniotic fluid. These are not routine in low-risk pregnancies, but there are some specific reasons they could be ordered. One common trigger is a fundal height measurement that doesn't match gestational age. What the heck is fundal height? This is the distance from your pubic bone to the top of your uterus. This is measured with a measuring tape in centimeters. From about 24 to 38 weeks, that measurement should roughly match the number of weeks pregnant that you are. So if it's 26 centimeters, that would correspond roughly to 26 weeks. If your measurements are consistently outside of the range of plus or minus 2 centimeters, your provider may order a growth scan. Other reasons for these scans include conditions like gestational diabetes, high blood pressure, or a prior pregnancy with growth concerns. Twin or multiple pregnancies typically involve growth scans throughout the second half of pregnancy. When you are pregnant with more than one baby, providers like to keep a very close eye on you. It's important to know, though, that growth ultrasound measurements are estimates. They are not exact. One study found that ultrasounds were accurate within 10% of the actual birth weight, about 84% of the time. Your provider will look at the overall pattern over time if you're having these done at regular intervals or going through several growth scans. So they're not just looking at one number to decide whether anything needs further investigation. If you are going through growth scans and you want more in-depth information on that topic, I will link to another episode in the article for this one. By the third trimester, you should have a general sense of your baby's typical movement patterns. You're going to know roughly when they're the most active, what kind of movements feel normal. You're going to be feeling all those kicks and punches, and how often they happen. Paying attention to your baby's movement patterns is one way that you can stay connected to your baby at this stage. If you notice a meaningful decrease in your baby's movement, call your care provider. Most of the time, decreased movement is not a sign of a problem. However, if you're concerned about it, it's much better to go in for a quick check than to stress out about something being wrong. This is a topic that genuinely deserves its own deep dive, and it will be covered in a future episode. The short version here is to trust your instincts, and not just with your movement of your baby. anytime a symptom comes up that you're concerned about, call your doctor or midwife. That's what they're there for. Even if it turns out to be a false alarm, getting that reassurance is much better than sitting at home worried. Ideally, your partner attends every prenatal appointment with you. And I know that that's a big time ask, and it's not really standard practice, right? Most partners are not going to every appointment. But this is such a great opportunity for them to be involved in your pregnancy, to ask questions, and going through these appointments together can make this whole experience feel more shared. In the second half of pregnancy, if you're going through any of these tests, many of the results happen in real time. A non-stress test result is reactive or non-reactive while you're sitting in that appointment. A biophysical profile score is something that you process while the ultrasound is happening. Other things like group B strep may take a few days to come back, but if you're going to have a conversation about what a positive result means and what happens during labor, that's one that would be helpful for your partner or a support person to be there. Anytime you're getting unfavorable or less than ideal test results back, it's really great to have your partner or a support person be present so that you're not going through that alone. There's also something about results of testing in the second half of your pregnancy. By this point, you're getting more physically uncomfortable, you're getting anxious to meet your baby. These decisions can feel much heavier, especially if it's prompting a conversation about a possible induction, a cesarean, a recommendation to come back for additional testing, if it's prompting changes to the birth plan that you were hoping for. It's much easier to process this with somebody who knows you, who supports you, and who can be next to you during these appointments. If you are going through any tests for fetal well-being, a growth scan, a biophysical profile, a non-stress test, please ask your partner to go with you. Or if they're not available, take a friend or a family member, your mom, somebody that can be there to support you. The big picture here is that you don't have to memorize every threshold. You don't need to know every detail about every single test. Going into one of these appointments, knowing what to expect, just having a broad understanding, and understanding what could potentially come next can help ease some of the anxiety and have you much more prepared. It can be stressful to have additional tests, especially as you're getting closer to your birth. But remember what all of this actually represents. This is your doctor, your midwife monitoring you and your baby to make sure that everything's okay. And every test is a tool that helps your care team catch anything that could potentially need attention early. And in that sense, all of this testing is a good thing, even if it feels stressful in the moment. To recap today's episode, we talked all about prenatal testing in the second half of your pregnancy. We talked about what makes this different from the tests in the first half, that you get many of these results in real time. We covered gestational diabetes testing, including the screening test and the glucose tolerance test. We also talked about testing for group B strep and what a positive result could mean for your birth. Then we covered fetal well-being tests, including the non-stress test, the modified biophysical profile, and the full biophysical profile, as well as growth scans. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share the podcast if you have a friend that's pregnant. So many listeners discover the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/prenatal testing third trimester. If today's episode was helpful, there's a lot more where that came from. Pregnancy Podcast Premium gives you the entire library ad-free in your favorite podcast app. That includes deep dives on a lot of topics we touched on today, like gestational diabetes, Group B strep, and more. Plus, get content for every stage through postpartum and life with a new baby. Check it out at pregnancypodcast.com/premium.